We would like to start by acknowledging the traditional custodians of the lands on which we are meeting today and pay our respects to their elders past, present and emerging. My name is Sushena Krishnaswamy and I'm an infectious diseases physician at the Royal Women's Hospital. I'll be presenting along with Sharon Heap and Pham, infection prevention and control nurse and AMS pharmacist here at the Women's. We'd like to say thank you to the National Centre for Antimicrobial Stewardship for hosting this webinar series for Antimicrobial Awareness Week and for giving us the opportunity to present our work on behalf of the rest of our team. Historically, AMS in the setting of obstetrics and gynecology has received relatively little attention. This poster reports on the experiences of implementing an AMS service at the Royal Women's Hospital in Melbourne, a specialist health service dedicated to the health and wellbeing of women and newborns. In 2019, the Women's dedicated resources for an initial 12-month pilot project for the implementation of a comprehensive AMS program to enhance the capacity of the existing AMS committee. The recruited AMS project team was multidisciplinary, comprising an infectious diseases physician, AMS pharmacist and infection prevention and control nurse. The objective of the AMS project was to improve antimicrobial prescribing and thereby patient outcomes, and to ensure that the organisation met and exceeded all components of the AMS clinical care standard. I'll now hand over to Sharon Heap to continue this presentation.
To inform the development of tailored education and other interventions of the AMS project, a survey of staff was conducted. The staff survey was designed to assess the awareness of AMS amongst all staff engaged in clinical work at the Women's. The survey revealed a limited awareness of the existing AMS service, that midwives and nurses were unsure of their potential roles in AMS, and that they lacked confidence in discussing antimicrobials with other clinicians, and a desire for greater education and involvement in AMS activities. We are currently repeating the survey a year since the implementation of the AMS project. We hope to show an improvement in awareness of the AMS service and AMS activities, and an empowerment of midwives and nurses to discuss antimicrobials with other clinicians and their patients. Key activities of the AMS service in this first year have included the development of a formal education program for all craft groups. We have produced brief educational videos specifically tailored for midwives and nurses, highlighting the significant role they play in antimicrobial stewardship.
Weekly ward rounds were launched to optimise antimicrobial therapy and provide direct feedback to prescribers in real time. The most common indications for antimicrobials have all been for prophylaxis, for preterm premature rupture of membrane, for whilst vaginal pack is in situ, and for surgical prophylaxis for obstetric procedures. And 3/4 of our recommendations for improved antimicrobial prescribing were accepted by the treating teams within 24 hours. These ward rounds have facilitated regular informal teaching opportunities and enabled improved antimicrobial prescribing and thereby, hopefully, better patient outcomes. We also participated in our first surgical national antimicrobial prescribing survey, and we found that 1/3 of our prescriptions for surgical prophylaxis were deemed inappropriate, mainly due to seemingly inappropriate timing of administration, and this has led to the establishment of a perioperative services working party to address documentation of key time points in theatre. All of these interventions aim to have an impact on improving health outcomes for women and newborns through reducing inappropriate antimicrobial prescribing and potentially delaying the emergence of multi-resistant organisms. The overall success of the AMS pilot project has led to the Women's approving ongoing funding of this novel multidisciplinary AMS service. Thank you for your time and for listening.